2020 was probably one of the hardest years of my life, and also probably one of the most exciting years of my life. As an infectious disease professional, having a pandemic is not something you hope for, but you always think about and plan for, and then obviously your training goes into motion. But it also, from the personal side, has its impact, just like it's impacted everybody else. 7 people in my family contracted COVID. 2 of them, actually 3 of them, ended up in the hospital. My cousin was lucky enough to not require long-term care there, but both my aunt and uncle passed from COVID. I grew up in Texas, on the border of Texas and Mexico, in the town called Laredo. And my aunt and uncle, Maricela and Ricardo Diaz, lived next door to me. So I grew up next door to my aunt and uncle and my cousins. And we joked that we sort of had an informal commune because we were the kids. I have 3 cousins that live next door to me. I have 2 siblings. We were always at each other's house all the time. Like, it was just back and forth. Oh, it was so hard. I mean, I was actually seeing patients in the hospital at the same time with COVID, and sort of knowing my aunt and uncle were going through the same thing. It was really, really tough. I'm the only medical person in my family, so I was also trying to be their translator to make them understand what was going on, what the things we could expect or not expect, and what was considered reasonable. And I knew they were in good hands. They were being well taken care of. Everything they were doing there were things I would have done for them if I had been able to be there. But yeah, it was hard because I also was still trying to make sure that we were doing the right thing for the hospital and the community, and you just have to sort of turn it on and turn it off, like depending on what I was doing. Like, I'd go to my office, talk to the doctors with my cousin, cry for 5 minutes, and then turn it back on because I had patients to take care of. I had things I had to do. So it was tough. I had all the knowledge. I have all the expertise. I've been telling everybody how to stay safe, and I couldn't have that impact on my family. And that is why it's so important now that we have these extra safety measures of having access to vaccine and still wearing your mask and doing the right thing, that I want people to know this is still important. We are not done with this pandemic. People are still going to die, and nobody should have to go through that, losing a loved one that's so close to them and cannot be replaced. Even when you're careful, even when you're cautious, my aunt and uncle were very cautious. They wore masks, they wore gloves, they washed their hands, they tried to avoid crowds, and they still got it. So I think this idea that you can still do everything right and still get sick is real. Thinking about, like, what could I have done different? What can I do different? It's really a sad statement that this is not unique to me. I lost 2 family members, but over 560,000 United States citizens have died of COVID, which means there's a lot of people out there without their aunts and uncles, without their parents, their siblings. And it's horrifying to me to think about. And why I'm even sharing this story is the idea that now we have ways that we didn't at that time to actually prevent COVID. We know masks work, we know hand hygiene works, but we have vaccines. The vaccines are safe, they're very effective, and they can prevent your loved ones or yourself from getting hospitalized or from dying. And at the end of the day, I can guarantee you, if we had had access to the vaccines at that time, my aunt and uncle would be here.